We are ready to get started. So again, my name is Andrea Merriam. I'm with PMD Alliance. We are the nonprofit hosting today, and we're so glad that you joined us. Today, we're excited to feature three amazing, their knowledge, their empathy, their dedication to the Parkinson's community is just amazing, and so excited to have them here joining us. So we have Sherrie Gould. Hi, Sherrie. She's a nurse practitioner in San Diego, California. We have Dr. Salima Brillman. Hi there. She's a movement disorder specialist practicing in Northern California. And Dr. Mindy Bixby. Hi, Dr. Bixby. Also a movement disorder specialist practicing in Southern California, in San Diego, and I think you still have some Orange County patients too, right? So
yes, definitely.
Yeah, so as I mentioned, the format first, we're, the topic today is broad on purpose. We want to talk about, navigating the holidays during COVID with Parkinson's. There's just a lot going on right now. And so I wanted to start with each of the three of you, kind of sharing your opening thoughts on this subject, and then we can turn to that Q&A portion. So I don't know. Do you want me to pick, or does anyone want to lead the charge and dive in?
I can start. I'll start. So some of you may not know me. I'm Dr. Mindy Bixby. Thank you so much for the introduction. And I have been seeing patients in office and also virtually for a number of months, as you all know. And I actually started seeing more patients in-house for some period of time, where I see probably about 17 patients in the office about 4 days a week. And then we're slowly changing back to virtual, ultimately because of the changes in the COVID numbers in our town. And so I'm sure some of you are experiencing that as well in regard to some of your practitioners and your providers not getting the opportunity to see you in person, which is one of my favorite things to do. And so not having that opportunity, I know it may be hard for some of you and for me for sure. And so ultimately, when we're moving through now through the holidays, a lot of us may experience, I think all of us, am I okay to say, are all experiencing the fact that we feel a little bit more isolated. Just basically because we need, and we're used to seeing our family members and our loved ones more in person than we are in virtual like we're doing today. I would love to see every single one of you in person if that was the case, but today not so much. But if we can find a way to know that we are in a space where slowly but surely we're getting some opportunities where we're going to have the vaccine, we're going to get back to reality in regard to moving forward in a really, really good way if we all do our part to keep it in a good space. And so ultimately, the reason for this Hear Me today is to actually hear you and see how you're doing in regard to the holidays and the COVID, and if you have questions about that, and ultimately with Parkinson's and moving forward in the best possible way so we can have an opportunity to have your questions answered for sure.
Yeah, my name is Sherrie Gould, and again, as I was introduced, I'm a nurse practitioner in San Diego. Been working with this amazing community of Parkinson's for 15 years and super passionate about the entire amazing community. And we all are super appreciative that we have this opportunity to interact with all of you and answer your questions. And this time has been incredibly not only isolating, but unbelievably boring for so many of us. I mean, we see patients that are not doing as well as they were when they were participating in every day in something, rock steady, or their singing group or their hiking group or something where they were getting out and fulfilling that huge part of who we all are, which is interacting with others, and especially interacting with others that we find lots in common with, people with Parkinson's. It's an amazing community and a lot of support we can gain from that community that we have lost during this time of COVID. But I hope that a lot of today's hour, we're gonna give you a few tools of how we're gonna get through the holidays, all of us, and but we're also going to focus hugely on the positive aspect of what's going on with these vaccines. It is beyond exciting. I'm sure most of you were in touch and heard about the FDA released their safety data this morning. It's what we've all been waiting for, to find out, okay, it sounds great and 95% effective, but is it really safe? Not just coming from Pfizer, but the FDA, who we really do trust and believe in, have really spent, mulled over hundreds of hours with all the people that are looking at the safety data provided by Pfizer, and it has found to be extremely safe. So we'll talk about some of that as well in terms of both effectiveness and safety. So hopefully everyone will leave this hour with some few new tools and some reassurance for a very bright future, and a future that gets us back to just even appreciating more than ever our community.
Yep. And just to echo what Sherrie and Mindy said, it has been a very long time for all of us, but we do have a light at the end of the tunnel, and we've put in many, many months, and it has been grueling for all of us, but that light at the end of the tunnel is right there. And so we just have to concentrate on it and just hold on a little longer. Yes, the holidays are going to be tough because we can't be with our families and give hugs and kisses to our loved ones, but just a little bit longer. It's right there. It's right within our reach. And so we can make it. I know we all can. We just have to stay safe and do the right thing for a little longer, and then we'll be there. So.
Very good.
I'm sorry. Go ahead.
No, please go on.
I just want to, mention, first of all, that patients with Parkinson's are not inherently more susceptible to the coronavirus. And it's important to know that, because Parkinson's does not affect the immune system. There is a few issues in terms of swallowing, and in case someone were to get pneumonia, et cetera, that we know might make, if someone does actually get COVID, might make recovery a little more difficult. But Parkinson's itself does not inherently make you more susceptible to the coronavirus. However, what does is all of our ages, right? So we know just cross ethnicities and male, female, whatever the case may be, the group that seems to have the worst outcome from the coronavirus are people 65 and older. So that is something we have to all keep in mind. But there was a really interesting talk that I listened to recently. It was given by Dr. Oken out of the University of Florida, and he had the 3 C's, and I think it was a good way to kind of keep this in perspective and remember it. But it was basically the 3 C's are cover, control, and contain. So we talk about covering your mouth. I know you hear this every day, but I'm going to say it one more time, because we have found over the last number of months in the area of public health, before we just thought maybe if you had symptoms, wear a mask, right? That was way back in March or April. But now what we know is if we wear a mask and we wear it properly, right? So it covers your face, it closes around your cheekbones and under your chin. It's not a bandana, and it's not like a neck gaiter that kind of loosely comes up, and it definitely covers over this area. And the people that you're with, mask to mask, it reduces the chance of transmission of this virus dramatically. There's like nothing more important, not even clean services, anything like that, that is more important than mask to mask. So I want everyone to remember cover, control, and contain. And control your environment. Make sure that over the holidays that you are, I know people are from all over the country during this talk, but as much as possible, be outside or keep some windows open so you get that fresh air going through, really important. And that even if you gather with your groups of 10 or less of families that you know have been safe, or your own family that you've had maybe some contact with, just set the table further apart. It's okay. You can kind of make it a bit of a game to, mask up until you eat. But when you eat, just make sure that you guys are all separated. Just another really important way to to be careful. And then of course, contain the size of group that you're with. And better still, you know, I've talked to so many patients, especially this past week, that had all these plans to even get together with their granddaughter from college who was in Arizona and was going to come to San Diego. And, you know, literally everyone has said, nope, not this Christmas. This is just one Christmas that we are going to stay home, and we're going to do Zoom, and we're going to try something new and different. And thank God it's limiting. And in this time next year, we're going to be having a whole different discussion.
That's so important. I appreciate the demo, had the mask handy. Anything that you wanted to add, Dr. Bixby or Dr. Brillman, or do you want to head to questions?
I think we should head to questions.
Yes.
What do you think, Mindy? Yeah, I think so.
I would want to hear you.
We want to hear you.
Well, then, Becky, if you could change our settings so that people could now unmute themselves, and just to help us direct traffic, if you could either put in the chat or raise your hand, or, you know, click one of the raise hand indicators so we know to call on you. But I'm going to start with a question from kind of appropriate from Michael J. Fox. It is Michael J. Fox of Tucson, Arizona. Always fun to see him on our registration lists, and I like that he gets a kick out of that, and you know, all in good fun. Michael had a question: might there be a problem for someone with Parkinson's and using Parkinson's drugs to take one of the vaccines? Do we know about any of that?
I'll take this question. We do not. Ultimately, they first started right at this point looking at the general population of how people react to the actual vaccine based on their immune system, not based on any medication they're on for any other disease process, whether it be hyperthyroidism, Parkinson's, high blood pressure, the interactions. Again, we do not stop the patient from actually getting vaccines for the medications they're on. Again, just to let you know, the medications that you're taking for Parkinson's are ultimately pretty benign in regard to interactions to most things, especially when it comes to a virus or a vaccine that you can use. I actually am a very big proponent of getting your shingle vaccine, getting your flu vaccine when you have Parkinson's, to protect yourself against other possibilities of other types of viruses, or possibilities of getting sick with Parkinson's disease. So I absolutely 100% stand behind a vaccine that may be able to control your possibility of getting the COVID virus. And so I do not think that there's a possibility of an interaction at this point with the medications that you're taking.
Thank you.
Absolutely.
I am looking for other hands. I don't see any other hands. Andrea, do you?
I think Judy Earlandson, did you have a question? You can go ahead and unmute and ask. Otherwise, we have one in the chat from Sheila.
I was just saying, what do we do then if we don't know the reaction to the medication?
So I want to just make sure this is clear. It does not look like there's an interaction among the medications that you're taking. Again, if that was the case, it would be with any other medication, not just necessarily Parkinson's medications. But again, vaccines are not usually causing any interaction with medications. And so that's not usually something that people think about in regard to moving forward with taking the medication or not taking the vaccine. So ultimately, what I would suggest and recommend is you continue the medications that you're on. Take care of yourself in regard to your Parkinson's disease. And when the vaccine's available for you, I would definitely wholeheartedly take the vaccine to protect yourself against the COVID virus.
Okay, thank you very much.
Absolutely.
Thanks.
Peter's waving his hand.
Hi, Peter. He's not muted. He's still muted.
He's still muted.
You can either hit the space bar or click unmute to unmute and ask your question, Peter. There you go.
Can you hear me?
Yep, we can hear you.
Yeah, all right. I'm looking for a comment as much as an answer. The other day, I was having a discussion with a fellow who worked in the medical equipment business, and we were talking about masks. And he said an N95 mask that they use at the hospital is the equivalent of a chain link fencing, and a mosquito going through it. But people get through it very, the virus gets through it very easily. But it's better something than nothing. But then I saw a little documentary on how much trouble we have in these ICU. The nurses are overworked, and another thing is to have to deal with the second wave. And one of the nurses made a comment about, we feel like we're here serving people who won't even wear a mask. So we're putting our life in the way of harm. Now people won't wear masks. Okay. And I thought we as a group or so should put a program together to say, whether you believe in the mask or you don't believe in the mask, wear one anyway for the sake of the nurses, by boosting morale. I just wanted comments about that.
Well, thank you for sharing that, Peter. I agree with you. I think, whether you believe in it or not, it is really important to protect yourself, to protect other people just by wearing the mask. And I mean, personally, I don't think it's a lot to ask for. The likelihood is we're not going to have to do it for the rest of our lives, but for this period of time, we really owe it to ourselves and each other to just wear the mask. So thank you for bringing that up. Yeah.
I totally support that. So incredibly important, and to wear the mask, correctly. I mean, anytime that you are around others, and again, and certainly encouragement for people. We talk about ways that we can deal with this time, and we've always said, it's important to try to get outside and get some fresh air, but just wear your mask, make sure it's a proper mask, make sure it goes over your nose and over your mouth, and it comes against your cheeks, that it's not loose all over the place. And that will really help, contain your breath inside, although you can breathe through. Either a 2 or 3 ply mask is what's really important. But then again, I want to emphasize mask to mask, then you have double protection. Other people are wearing masks and you're wearing a mask, but getting outside is really for a little fresh walk, even if the weather's getting a bit chilly, but there's something about getting that fresh air, even through a mask, that is really important.
Good. Next up, I think Bill Anderson has a question. Do you want to go ahead, Bill?
Hi, it's actually his wife, Martha. And we've known Mindy since she was a little girl, so we're so excited.
Hi.
Hi, Mindy.
Hello.
Bill's over sort of taking a snooze in his bed, in his chair. But I wonder, and I'd love to hear from Mindy, if you want to just talk a little bit about the role of exercise. Bill does rock steady boxing. And one of the things that's been tough is obviously he's not going to the gym to work out. So we're doing remote Zoom classes, which are okay, but they're not the best, but that's what we can do right now. So I just wonder if you've got any other thoughts about exercise.
Yes, absolutely. Exercise, one thing. You look so wonderful, by the way. Can't help it. I have to talk to her personally. So happy to see you. So we have devised ways to actually do other things. I mean, Zoom is extremely important, but it's not as effective because you're not right in front of somebody moving forward and kind of pushing you in a way that you would like. I do have several other aspects of patients that are working on. Hi, Bill. working on opportunities to actually work among small groups, but again, 6 feet apart, that are optional for you as well. That's really actually helped a lot of people feel like they're still in the game with other people. That's a huge thing. I don't know what's like in New Jersey and what you would need to do in regard to what is available for you. I have this amazing lady, and again, I have to say, have a shout out to her because she's really helped a lot of people. Her name's Claire McLean, and she has found that she can really hone in on somebody's skills and actually give you a personalized exercise program, even if it's in-house, to help you. It's Rogue Therapy, ROUGE therapy, and she's done about 90 hours of therapy that's free for anybody that would like to tune in with her. She's really, really an amazing human being, and she's actually helped the Parkinson's community quite well in Orange County and also in California and abroad, especially with the Zoom capabilities. And so if you can find a way to say, okay, this every day, 30 minutes, I'm going to do these certain things to help you and build forward, then you're going to get to an opportunity to be able to say, okay, I checked that box. I made that happen every single day, because you'll definitely see a difference in your walking, your stiffness, your slowness, your tremor, if you're exercising every single day. And so that's one thing I would suggest. The second thing is, yes, rock steady boxing is super important. If you have some of the equipment at home, that's helpful as well. But if you can find ways to actually build yourself into a virtual way that you have to check in and make it happen, then you are more likely to make sure that you actually do it, and to get to a place where it becomes a routine for you, even if you are in the COVID isolation moment. And so it's all about moving. And then we all know that if we don't use it, we lose it. And especially during the time of COVID, we don't have as much opportunities to do that outside the house. But again, I have had patients actually get to a place where they're actually going into a large area. And again, depending on New Jersey, I don't know how cold it is right now, but even going to a place where you're 6 feet apart, but you're still in a place like, for instance, a park, where you're able to move yourself. Because again, movements in a big location are so much easier for you, because the smaller the space, the more stiff you may feel, or the freezing may happen. And so if you can have spaces like that, that's optimal for you, especially when it comes to COVID. You're going to get outside, you're going to get some fresh air, you're going to feel the breeze on your face, and you're going to feel a little bit more like you're in the land of the living, because ultimately a lot of times every day we have this Groundhog Day. Every day feels the same day over and over and over again. And if you could find a way to actually build in that, I think that would be very helpful. So make sure I'll send out that information so everybody has it for Claire McLean, because she's amazing. But ultimately, I would love to talk to you personally too and see how things are going. Okay.
Good. Thank you. Thank you.
Absolutely. Much love. See you. Take care.
And most important, your bowels will move.
Yes.
Absolutely.
That's a great, Dr. Bixby, just that big spaces are better for Parkinson's people anyway. So whether you're going to the park to, exercise, try a class, do it by yourself, or even maybe when you're setting up your home rock steady boxing area, don't pick a cramped guest room full of boxes. Pick a nice empty open space to get the most out of it.
For sure.
And
absolutely.
Thank you to Lauren for putting Claire's website information in the chat. That is there.
Thank you, Lauren.
Yeah. So I wanted to do one question from the chat, and then I'm going to go to Dave. So don't forget your question, Dave. But the Winters said, the holidays can be a dark time for so many. Any mental health tips? Thinking of all my care partner buddies out there. That's kind of a broad question, but I don't know. Anyone want to chime in that arena?
Well, I think that it's really helpful to actually even set up. I mean, it's of course not ideal, but again, look at our Zoom conversation right here. We're able to connect with people from all over the country via Zoom. And I think that it's really during these kind of darker, quieter days, especially around the holidays, just set up Zoom talks with your family, with your grandkids. It'll be fun. They'll get a kick out of it. We're all learning the technology better. And I think it's about connecting with others. It's really connected with other like-minded people. And so things like Zoom or any of these other platforms where you can actually see people, I think is really, really helpful. And in order to do that, you actually have to kind of set it up like a date, like email your friend or call your friend or your family and say, hey, tomorrow at 3 o'clock, what are you doing? That can always be really fun for you and make you feel connected. It's, again, nothing will ever replace a human embrace, but certainly just that conversation. I know that my husband and I have done that quite a bit with friends. I mean, we aren't getting together with friends either. And so we're like, okay, let's have happy hour on Friday evenings or anything like that. But so that may be a good suggestion.
I would agree. I think it's really important that if you can schedule things, it becomes to a place where you're like, okay, I'm looking forward to that Tuesday. I know I just need to get to that Tuesday because I have this wonderful opportunity to be able to be around my friends. I mean, all of us have felt it. I just had my 50th birthday yesterday, and it was very interesting to move forward and 50 years old on my own, but I also had an opportunity to have a Zoom call with all my beautiful family and friends, and it was different from any amount of opportunity that I would normally have. But I was so grateful because I felt heard, and it was really nice to talk to people and feel like, okay, we're all out there together. We're all doing this together. And in time, I mean, I have friends that want to just sit and maybe work on some things together for ultimately the Parkinson's Foundation and the Parkinson's community, and get an opportunity to like, go, let's strategize. What can we do in January? So January is coming up. What can we do? And so that opportunity, even though we're not sitting there together and talking, we have something where we have a goal in mind, we move forward, and we get off the call going, hey, that felt really good. I got to another space in my life that I'm going forward, and I don't feel like I'm just sitting still all the time. Thank you, Lauren. Thank you. Anyway, so that's a thought. What do you think, Salima?
I agree. I think it's super important to have something to look forward to. And I think, making a date, like, dates with our friends and having the happy hours or appointments with our, kids and nieces, nephews, whomever it is. I think it's something to look forward to, and I think it would help get us through this time. So I think it's super important, and reaching out, and the fact that we can do all family members can be there at the same time, which I think is awesome, because if we were traveling and we were just going to see, certain family in one part of the country, then we would have to leave out some other family. But in this case, we can really see everybody at the same time, which is, I mean, there is a silver lining in that respect. We can see everybody at the same time. So, I mean, we can do that.
There's also CBD and cognitive behavioral therapy. If you really feel like you need a therapist, there's some wonderful people out there that you can, I think almost all the cognitive behavioral therapists are now doing virtual Zoom meetings. And so talk to your local neurologist and see how you can get involved with that. I think all of us need therapists. I mean, you need a therapist, I need a therapist. It's just something that's important for us to be able to have our voice heard. And maybe in that interaction, you may be able to have opportunities to actually heal in regard to what you're going through right now, so that you can move forward. When January comes, you're all ready for it, and when the vaccine comes. So
I agree with you, Mindy. I think it's really important to get those feelings off of your chest. And sometimes, we feel like we can talk to our spouse or, our best friends and everything. And that's great. And they're wonderful resources. But having a third party, someone who's unbiased, actually is a good opportunity to have just a separate set of ears. I think it can give you a different perspective as well. I think it's important as well.
I think it comes all, in that everyone has kind of alluded to the idea of actually planning some things for the next day. Like when you go to bed, like, okay, in the morning, I'm going to do this, that, and the other. I'm going to have a Zoom talk with my granddaughter. I'm going to do some cognitive therapy, or so our brains don't, just all this being inside with the same family members, sometimes our brain feels like it can turn to mush. And so there's some amazing, software programs that you can get to on the internet. One I've heard of recently is called constanttherapy.com. And it basically it's actually designed for people with neurologic disorders, and it helps speech. And it actually is a website that actually helps with memory and cognition. And so, you know, cognition, as we talked about actually in our last Hear Me series, can be challenging and can definitely present some problems. And so, you know, even planning something like I'm going to do, you know, I'm always going to do my exercise, something where you're going to move your body, and I'm going to have that social connection sometime during that day. And I'm going to exercise my brain. I'm going to get my brain moving. I'm going to do something, all these things that are good for me to keep me healthy, so we can get through this COVID in the best way possible.
Yes, and I agree. And I've been watching all this chat back and forth, which I think is awesome. And that's why we're all here together. We're here together. I mean, this is a wonderful opportunity for us all to be able to hear us. And so I was looking at, I know that somebody said about the darkness. Just so you know, the 22nd or 23rd, I believe, is the darkest day of our years. And then it starts to get hot, more and more light every single minute. So know that, for one. Two, some of you are experiencing a lot of dark days in regard to just it not being very sunny outside and not being able to feel the sun on your face. And so I also have talked a lot about seasonal affective disorder, which ultimately can happen and in the face of COVID, maybe a little bit harder for you. And so some people do light therapy, light box therapy, that you can get the light box on Amazon. In fact, I'm not trying to push Amazon, but you get a light box that can improve your ability to actually have some of that UV happiness to allow you to actually feel like you have some light in your life, if that makes any sense. And so I think all of us would need a little bit more light. So that's the thought process of what would be helpful for you guys. And so I also music, getting some groove on. It allows you to move,
Definitely.
exercise, and also have that, remember those words to those wonderful songs that you have. That's a cognitive therapy there, right there. So what a wonderful thing to just turn on your radio or your CD or your whatever you
And
do.
dance.
So that's the thoughts.
You can
Absolutely.
do
Dancing
dance
is everything.
and sing, kill two birds with one stone,
Absolutely.
and have fun.
Next Hear Me, we're all dancing.
There you go. You don't have to ask me twice.
Me too.
Love it. Now, Dave, I told you to remember your question, and that was a while ago. So this was a cognitive exercise in itself. Did you still have a question?
I'm a comment and a question. First, I want to send a big hello and a virtual hug to my old friend Sherrie. Hi, Sherrie.
Oh.
Hey, hi, Dave. How are you? Good to see you.
Good to see you. and I had a question for the panel. Can you comment on a new drug from Sanofi that I don't know if I'm pronouncing it right, Kenkobe or something like that?
Kind Moby, yeah.
Can you comment on that?
Yeah, I certainly can. I'm actually giving a talk on that right after we finish this. So yes, it's actually a sublingual apomorphine. So it's a dopamine agonist that you don't inhale it, you don't take it as a pill, you don't inject it. It's just like similar to like a Listerine strip, Dave, that you put right underneath your tongue, and it just dissolves within 3 minutes. And within, in the clinical trials, like 30 minutes, people were able to, majority of people really did experience kind of the same on that you do with a dose of levodopa. So it can be used like there's different doses, 10, 15, 20, 25, 30. And everyone has to kind of titrate up to which dose works best for them. But it's super convenient because it comes in little foil packets. You can put them in your wallet or in your pocket. So when you start to have one of those many different types of offs, you can just take one out, put it under your tongue, and it's a use for off episodes, definitely. So it's pretty brand new. I think it's only been out, 2 or 3 months or so.
Yes, Kenobi, if you recall, some of you may know about Apokyn. Apokyn is similar to the idea of how it works, mechanism of action, ultimately kicking in within 10 to 30 minutes based on what your body's doing, and deciding what dose is best for you ultimately is like a trial that you go through to figure out which strip is going to work for you for the same amount of benefit than your normal dosing of whatever you're taking in the dopamine replacement realm. The whole goal is actually to help the bridging of one dose to another, whatever dose you're taking already. So Kenobi's not taking away the medications you're already on is actually benefiting you to have the bridge, so you actually feel nice and steady all the way through. Some people only use it in the mornings when they're first waking up because they don't have anything on board, because they haven't taken anything since the night before. And so sometimes it actually gets a kickstart kind of idea to actually get it started. And so depending on why you're using it, some people just use it as needed. They put it in that pocket and they may never use it. It just makes them feel like, okay, if I did have this moment, it would be there for me. Does that help?
Yes, thank you.
Okay. Absolutely.
I'll share, actually all three of the clinicians on the panel today participated. So PMD Alliance is releasing a new resource in January where we asked providers, tell us 2 minutes on, insert drug name here. And we did all of the drugs that are approved for Parkinson's. They're going to be pre-recorded so that you can watch them, rewatch them, rewind, share them with other people, because that's a question that we get a lot. Wait, what about either that new drug, or I never had orthostatic hypotension and now I do. I never listened to all of that. What is that drug? So stay tuned in our, keep track of our emails and whatnot. That's going to be coming out in January. And thank you to all of you who have done some of those recorded segments to help disseminate that information.
Sure.
I have some great chat things to share, and I love it when the tips come from the audience. Lauren recommended turning on your camera when you're on Zoom. When you're doing exercise classes, it helps you keep moving, and maybe it has that accountability.
Definitely.
We also shared,
So good.
Yeah, we shared on our Facebook page, I'll try to find it, but someone did a study on whether virtual eye contact activates the brain in the same way that in-person eye contact does. And it sure does. Like, it still releases all those lovely brain chemicals. So we always try to stare into the camera and be with you when we're on here. And then someone mentioned apathy, specifically in regard to the planning and some of the intentionality tips that you guys were sharing. And Judy specifically said she's planning a Christmas in July. I don't know.
That's great. That's awesome.
I love that.
Additional thoughts on apathy? It's hard for everyone with COVID, but add in that symptom and, it can be a doozy. Anyone want to add anything about apathy?
Sure.
Apathy is hard. Go ahead, Mindy.
It's more just defining it first. Let's define it first and understand what that is first, because a lot of people have found that they have apathy, but they're not depressed. And so that's a big difference between the two things. And some people that are surrounding them may say, hey, they're not the way they used to be in regard to wanting to go and do the things they used to love. And they automatically think that person is depressed, and they're not. It's literally, they just don't have the wherewithal that they want to go and do things. And so it's very common with Parkinson's to have apathy. And doesn't necessarily mean that you're sad or anything like that. It's just that you just don't like the things you used to like before, or you may not have the fire beneath your bottom to keep on going in so many regards. And so apathy can be an issue in regard to trying to keep yourself going when it comes to not having as much stimulus at outside sources, because you're in-house taking care of yourself in regard to isolation. And so, yes, absolutely. Apathy has actually been shown, if you can get your schedule set up and keep yourself in getting a little bit of a reward every time, you're more likely to actually continue the wonderful things that you have set forth for yourself in a everyday life. Does that help?
And don't you find, Mindy and Sherrie too, that apathy is not, it's really difficult really for the caretaker to understand, like, why doesn't Bob want to do the things? Why doesn't he want to see the grandkids like he used to want to see them? And it's not something against the grandkids. It's just this feeling of, I just don't feel like it. Not that he's depressed, not that he dislikes the grandkids. It's just this apathetic, don't really care. And it's part of Parkinson's, and it's not to upset the care partner or to get under our skin or anything. It's just part of it. And it's but like you said, Mindy, doing the daily thing, the reward, and that's part of trying to get over it. I think it's much harder during this time as we see the Groundhog Day type of thing. But
And I think it's an important role for the care partners to not pose the question of, well, what do you want to do today? Or what do you want to read today? Or it's more like, let's have very specific activity. Let's go out and see the Christmas lights tonight. Let's hit the neighborhood. So, if you make it a general question, then it's super easy, especially when we talk about apathy, to just say, no, not in the mood, versus we're going to get in the car at 6 p.m. and look at the lights. Way different way that it's received too by the patient. It's like, okay, I guess we're going to do that. And then after they do it, I mean, there have been multiple studies after they do go see the Christmas lights. I'm really glad I did that.
Absolutely. It's
so important.
It's amazing. I think it comes down to, I think all of us, sometimes it gets a little bit hard to just kind of push through the next moment. And again, just to understand a little bit more about the biochemistry of apathy, what happens in Parkinson's is that your dopamine receptors in your limbic system are just a little bit different. Your limbic system is your emotional centers, your drive, your desire centers. And so sometimes they can be a little bit awry, meaning that sometimes you can have a little bit of impulse control, which ultimately you want to hyper shop or hyper gamble or hypersexuality. And that there's just a little bit of a change in regard to how the neurotransmitters are working in that location. It also can happen with apathy, where they're just not stimulating enough in the areas that make you happy, and the desire, not happy, but desire centers, like the things that you are normally like, wow, I love to play golf. That swing feels awesome. And it doesn't feel the same anymore. So you just don't go do it. And so seeking it on a regular basis, and sometimes the dopamine kind of gets a little bit more excited again. And you can actually get that feeling of that swing back if you're doing it on a regular basis. And so sometimes, I have a lot of family members that have Parkinson's, and we talk about the fact that what would work for you when it's not in the actual moment of having to make a decision of doing something. I ask them, what would be the best way for me to approach it? Because they say, well, I would have liked to have done that, but for at that moment, I just really didn't feel like doing it. And they asked, and my grandmother, for one, said, just give me 2 options. And so I only have the 2 options. It's not no, it's like, do this, or I want to do that. And then I go, I'll be more willing to go, hey, that one sounds a little bit more appealing to me. And then they're actually actioning, doing something right then. And so that's kind of the thing that we have worked on. And again, everybody's different. Everybody's, again, this is an individual disease, this is an individual moment. Yeah. And so understanding how is best for you to work through the apathy is really important.
But that's a great strategy. 2 options. I think that's a great strategy for people to work with.
Yeah, thank you. Yeah.
And Sheila commented that so we talked on another program about care partners call themselves combo cheerleaders and prison wardens. And Sheila said her prison warden side, her person with Parkinson's is always happy after they've done the specific thing that she forced him to do. So yeah. Strongly encouraged, right? Thank you, Sheila. Yes. Important distinction. So thank you for that. And let's see, we have Peter there, Peter, like 5 minutes ago, you walked by with a guitar, and I'm going to unmute you because I think you have things to say, things to share with us today.
Just on the issue of apathy, I've been studying this for years. And it's very hard to understand. Well, it's the loss of the anticipation of the reward that you get for making a decision.
Yes.
Mm-hmm. And that's my definition of the loss of the anticipation for the reward you get for the decision you make. And if you lie around the house, for instance, you constantly you're doing things you know you shouldn't be doing. That you should be taking the garbage out, you should be getting ready for dinner, or you should be asking your wife out to dinner, or whatever it is. You know you should be doing these things and you don't. And do that often enough, it becomes very depressive. That's where the depression in Parkinson's comes from. So you have to recognize that when you just said, no, I don't want to vacation, or no, I don't want to go visit your sister, or whatever it is, what you've done is the dopamine has been called and got there in the right quantity because it modulates the effect of the loss. That's all I want to say about that.
I would agree, absolutely. And tips to the patient is really part of our makeup as human beings is knowing that there's going to be a reward or something that makes me feel good, or understanding that the cause and effect of things are not as clear as they used to be. And so sometimes just pushing through it and getting to that place where did you still get that gratification of feeling good by doing that is always the question. And it's not always like the anticipatory, like you said, it's not always there to remember how that feels. And then once you do it, they're, oh, okay, now I remember, but sometimes it's not very keen from cause and effect. That makes a lot of sense. It's
very nuanced. And I think, thank you, Dr. Bixby, for explaining the, maybe the science behind it. And then thank you, Peter, for that, bridging that. And that's, from your perspective and, how you experience it. It's complex. So the more we can talk about it and understand it, then the better we can talk to our doctors about it. Absolutely.
Sure.
Yeah. I have another tip from the chat about masks that are see-through, so you can see your facial expressions and mouth, and Mrs. Volker or Mr. Volker put a name where she finds them on Facebook. Now, Parkinson's does have that, masked expression. When you add the physical mask to that, I would imagine that really adds a lot of complications. Do your patients bring this up, or I don't know, is that something that you all have noticed and want to make a quick comment about?
Well, let's first talk about masks when you haven't met the person first. I'm a huge proponent of saying, hi, this is me. My name is Mindy. And being able to put it back on and having other people have that opportunity too, because again, we need to feel like we're human here in regard to understanding that we're going to miss that opportunity if we don't get to see each other's faces. That's the first step. So I do like the see-through mask, just as long as we get the nice covering and the nice fit. The second thing is, yes, I mean, actually, no, I haven't seen a lot of people say, okay, because I have a mask and I already have a mask faces at times, that there's a big change in that. And I can see that when I am evaluating somebody that has a mask on, I'm much more prevalent to looking at their eyes. Again, the eyes also tell you a lot about how the Parkinson's is doing in regard to the blink rate and your eye movements and everything else. So it's quite helpful for us. But that said, I haven't really gotten into the fact that it's changed the way I treat or the way I perceive the patient in regard to having a difference in whether the mask be on, except for I just want to see your whole beautiful face. And so that's the thought I have. Again, I'd love to hear from the other two, please.
Yeah, no, I think that it's one of the pieces of, I'm so sorry, of telemedicine too, is that, we've really entered a world where I'm sure many of you that are on this call have had your visits with your provider through telemedicine. And actually, I do tell patients when I see them on telemedicine, I do like seeing their face. It's the beauty of telemedicine, right? Because it's super safe. It's comfortable from your own house. We can, we talked about this last time, but I'm going to reiterate it that, we really have found that Parkinson's disease is probably one of the easiest disorders to actually do a really constructive telemedicine visit with. And especially now with all the masking things that I can see people's face, I can see them close, I can see them far away, I can watch people walk, we can all do the normal interview about all those important things in Parkinson's, the motor and non-motor symptoms, and bring up their concerns for that 30-minute visit. So a plug for telemedicine. I think that it is definitely here to stay. And I think that that's definitely one of, again, a huge advantage of telemedicine.
I agree. Salima?
questions out there?
Yeah, so I was just going to say that I agree with Mindy in terms of the mask and looking at the blink rate and such. I don't think the mask poses a problem. I think if there were a clear mask, that's great to be able to see smiles, and potentially if a person has a tremor, any oral dyskinesia. But other than that, I don't think it makes a difference in terms of the masked faces that we would get it with the rest of their face.
Good, and I like how that brought in the telemed, silver lining. You know, one of the, if we're gonna have to go through this, we might as well acknowledge and be grateful for maybe some of the silver linings that came out of it. Well, I think we've covered most of the comments in the chat. Roger in Indiana has been, you know, as usual, always sharing his positive comments and things to make us smile. Thank you, Roger. We hear you and we appreciate that. And we're coming to the top of the hour, and I know all three of you have, you know, busy schedules. So wanted to give you the chance to, you know, maybe add some closing comments, anything else that you didn't get the chance, you know, that didn't come up in the questions, to close us out and set us on our way to celebrate the rest of December. I don't know who wants to go first.
I'll start. I just wanted to tell you that I'm here. We're all here trying to move forward together. And ultimately, just please know that all of us are, if you have any questions and concerns or anything you need, that's why we're doing this. The whole goal of Hear Me is to allow you to know that all of us are in it together. And every step of the way, we have answers for you. We have an opportunity to actually build something and build you up, you know, like heroes. That's our goal, is to keep you going and making sure that you know that you are heard, whether you be someone that has Parkinson's or a family member that has a family member that has Parkinson's. We all have Parkinson's, because ultimately we're all trying to build together, making sure that you're up and running and feeling like you can actually really strive every single day. And I know the end of the year, sometimes it gets a little hard, but just know we're about to go into 2021. We're about to have a vaccine. We're about to have opportunities in so many different realms in regard to new medications that are coming on with Parkinson's, finding that cure every single day and moving forward to getting you nice and healthy. So keep yourself going, because we have another year to start moving forward and making sure that we have opportunities to help you every day. And so just know I'm here and we're all here. And that's why we do this every day, because we want you to know that we love coming into your house and be able to talk to you and be able to have opportunities to actually make sure that you know that today is just today, and we're going to keep on moving forward, and we're going to do all the wonderful things to keep ourselves healthy, so that when the vaccine does come and we're able to come around and hug each other, we'll be ready in every possible way.
Absolutely. Keep safe and keep positive. And remember, we really are so close in terms of COVID. It's just a few more months. I really believe that with the vaccine coming around and the positivity of that, and hopefully by the grace of God, by the summer, we'll be able to be more in a normal sort of a fashion. So just a few more months, and just keep hope and keep positive. I think that's what gets us through, and stay safe. And like Mindy said, know that we're here for you. We are just you are the people that keep us going, and we are so grateful to have the privilege to speak to people with Parkinson's and their caretakers, and we're just happy to have this opportunity. So whatever you need from us, we're happy to address. And if there are topics that you are interested in hearing about, please do ask Andrea and Becky and Rebecca and Sarah. We hope to do this every 6 weeks or so. So we would love to address things that maybe you have questions about. So stay safe and happy holidays.
And just, I mean, they both said everything so eloquently. I want to echo everything that both Salima and Mindy said, but just keep that schedule going, keep that mental exercise going, keep moving your body every day. Keep listening to all of these amazing lectures that PMD Alliance is offering literally every day. There's professionals and experts from around the country that are talking about a myriad of different things. And it's part of what we talked about keeping that brain active. And then of course, as we couldn't say enough about keeping your body active, you've got to just think every day, every single day about moving your body. In whatever capacity you can, please just keep moving your body. Your body needs to move, remind your brain, we need dopamine. So just keep that body moving in whatever fashion you can. And we are going to get through this. That vaccine is here, not only one, not only two, but three. And more, I think, are still about ready to come out with the data. So I think we need to be hopeful. I'm super happy that we had this Hear Me series at the point where the vaccine actually is now being delivered in the UK. I mean, the 90-year-old was the first one I heard that actually got the vaccine. And so we have to be super hopeful about all of that. And I think we're going to talk to everyone again at the beginning of the year to kind of kick off a incredibly positive year 2021 to all look forward to. And so in the meantime, get out those Hanukkah decorations or those Christmas decorations and decorate your house. Even if you don't have a ton of people and family coming over this season, you can enjoy it. So don't leave that stuff in boxes, you guys. Take it out and plug in those lights and blow out those candles and do all of those things that make us feel so wonderful about Christmas. And I too want to thank everyone for giving us the opportunity to talk to all of you. We just adore this community and we are here to help in any way we can. So I look forward to talking to all of you at the beginning of January once again. So happy
holidays.
Bye. Take care. Thank you.
Take care.
Thank you.
Thank you for everyone for joining and all of the great things that we discussed. I put the link for the January 7th in the chat. We hope that you tune back in the beginning of January so we can kick off the new year together as well. That wraps us up for today. Bye now.
Bye. Till next time.